Welcome to our video on the treatment and ethics of psychological disorders. Understanding these concepts is crucial for anyone interested in mental health. Throughout this video, we'll take an in-depth look at a range of topics, from the effectiveness of various psychotherapies and the importance of evidence-based interventions to the critical role of a strong therapeutic alliance. We'll cover it all. We'll also delve into biomedical therapies and how treatments have evolved over time, moving from asylums to community-based care. And of course, we'll discuss ethical principles like non-maleficence, fidelity, integrity, and respect for dignity that guide clinicians in their practice. So stay tuned and let's embark on this educational journey together. Let's delve into the different types of psychotherapies and examine their effectiveness. Psychotherapy encompasses a variety of treatment techniques aimed at helping individuals improve their emotional and psychological well-being. Among the most common forms are cognitive behavioral therapy, psychodynamic therapy, humanistic therapy, and group therapy. Each form addresses different aspects of psychological distress and utilizes distinct methods. Research has demonstrated that psychotherapy is generally effective in treating various psychological disorders. Meta-analyses, which aggregate the results from multiple studies, consistently show positive outcomes for clients undergoing psychotherapy. However, the degree of effectiveness can vary based on the type of disorder, the therapeutic approach, and the individual therapist's skills. One notable aspect that contributes to the success of psychotherapy is the therapeutic alliance, the collaborative relationship between a therapist and their client. A strong therapeutic alliance is characterized by mutual trust, respect, and agreement on treatment goals. Studies indicate that a strong therapeutic alliance significantly enhances the likelihood of successful outcomes in therapy. It's also crucial to consider evidence-based interventions when evaluating the effectiveness of psychotherapies. These are treatments that have been rigorously tested through scientific research and have consistently shown to be beneficial. Incorporating evidence-based practices into therapy ensures that clients receive the most effective treatments available. In summary, psychotherapies are diverse in their approaches, but share a common goal of alleviating psychological distress. The general effectiveness of psychotherapy is well supported by research, with the therapeutic alliance and evidence-based interventions playing key roles in ensuring successful treatment outcomes. Next, let's look at evidence-based interventions. These interventions rely on treatments that have undergone rigorous scientific testing. This ensures that the methods used in therapy are not only safe, but also effective. One major advantage of evidence-based interventions is that they are backed by research data, providing a solid foundation for treatment plans tailored to individual needs. The use of evidence-based practices means that therapists can make informed decisions using the best available evidence. For example, cognitive behavioral therapy, or CBT, has been shown to be highly effective for a variety of psychological disorders, such as anxiety and depression. Another example is dialectical behavior therapy, or DBT, which has proven successful in treating borderline personality disorder. By focusing on scientifically validated methods, therapists can approach treatment with confidence, knowing they are using the best tools available to help their clients. In contrast, practices that lack scientific validation may not only be ineffective, but could potentially cause harm. Therefore, turning to evidence-based interventions is not just a matter of best practice, it's an ethical imperative. This approach values the client's well-being by emphasizing treatments that are proven to work, ensuring the highest standards of care. A strong therapeutic alliance is essential for effective treatment in psychology. This alliance is the collaborative and trusting relationship between the therapist and the client. Research has shown that when clients feel heard and understood by their therapist, they're more likely to engage actively in treatment and, consequently, experience positive outcomes. Building this trust involves open communication, genuine empathy, and mutual respect. It's about creating a safe space where clients feel secure to share their thoughts and feelings openly. This relationship is the cornerstone of many successful therapeutic interventions. Moving on to biomedical therapies, these treatments involve medication and other biological interventions to manage psychological disorders. These play a crucial role in treating conditions like depression, anxiety, and bipolar disorder. These treatments work by altering brain chemistry to help stabilize mood, reduce symptoms, and improve overall functioning. Common types of psychotropic medications include antidepressants, anti-anxiety medications, antipsychotics, and mood stabilizers. While effective, it's important to remember that biomedical therapies are often most successful when combined with psychotherapy, providing a holistic approach to treatment. By understanding and using both psychological and biomedical treatments, clinicians can offer comprehensive care to individuals with psychological disorders. Let's take a look at the historical changes in treatment for psychological disorders. In the past, asylums were the primary facilities where individuals with mental illness were confined. These institutions often provided inadequate and inhumane conditions. However, over time, a significant shift occurred with the rise of deinstitutionalization. This movement aimed to replace asylums with community-based care. Deinstitutionalization promotes more humane and effective treatment within less restrictive environments, allowing individuals to receive support within their communities. This shift has dramatically impacted the way psychological disorders are treated, striving for better outcomes and quality of life for those affected. Ethical principles are the bedrock of psychological treatment, serving as a compass to ensure each client's well-being and safety. Let's dive into these crucial principles. First, we have non-maleficence, which means do no harm. This principle reminds therapists to avoid causing injury, whether physical or psychological, during treatment. Next, fidelity is about maintaining trust between the therapist and client. It emphasizes loyalty, confidentiality, and commitment to keeping promises and professional standards. Integrity is all about honesty and accuracy. Therapists must be truthful, upfront, and transparent with their clients, ensuring that they provide accurate information and avoid misleading them in any way. Lastly, respect for people's rights and dignity is vital. This principle involves honoring the autonomy, privacy, and freedom of clients, treating them with the utmost respect, and valuing their personhood. Understanding and adhering to these ethical principles is not just a professional obligation, but a moral one, ensuring that treatments are both ethical and effective. In conclusion, we've covered a comprehensive overview of psychological disorder treatments and the ethical principles involved. First, we looked at the effectiveness of various psychotherapies, which are supported by extensive research and meta-analyses. Evidence-based interventions, which are scientifically tested treatments, were also highlighted for their proven efficacy. We delved into the importance of a strong therapeutic alliance, emphasizing the relationship between therapist and client. Additionally, biomedical therapies such as medication play a crucial role in the treatment landscape. We also explored the historical shift from asylums to community-based care, illustrating how deinstitutionalization has impacted modern treatment approaches. Finally, we discussed the fundamental ethical principles like non-maleficence, fidelity, integrity, and respect for people's rights and dignity, which guide psychologists in their practice. Understanding these aspects is key to providing effective and ethical care. Thank you for following along as we unravel these essential topics. Let's test your knowledge with some true or false questions. This will help reinforce what you've learned. Question 1. Meta-analysis combines results from multiple studies to assess the effectiveness of treatments. True or false? Next, the therapeutic alliance refers to the physical environment of therapy sessions. True or false? Remember, deinstitutionalization aims to provide care in less restrictive environments. Is this true or false? Consider what non-maleficence means. Does it refer to promoting the well-being of clients? True or false? Finally, think about the role of ethical principles. Do they guide psychologists in providing ethical and effective treatment? True or false? Let's review the answers. Did you get them right? Answer 1, true. Answer 2, false. The therapeutic alliance refers to the collaborative relationship between therapist and client. Answer 3, true. Answer 4, false. Non-maleficence means avoiding harm. Promoting well-being is known as beneficence. And answer 5, true. Great job on tackling these questions. Reviewing material in this way helps consolidate your knowledge and understanding. Thank you for watching. We hope you found this video informative and engaging. If you enjoyed the content and want to learn more about psychology, please hit the like button, leave a comment, and subscribe to our channel. Your support helps us create more educational videos like this one. See you next time.